I kind of ran out of time on that delightful laxative lecture, so we're still talking about laxatives, and we were talking about adverse reactions to laxatives, which mostly are going to be cramping and diarrhea. However, it can cause nausea and vomiting. Depending on what's causing the constipation, the person could have an actual bowel obstruction, and introducing something that's going to speed up peristalsis many times will cause that obstruction to become more inflamed and swollen and obstructed, and the person is going to have more and more trouble passing stool, if he's able to pass it at all. So that's something that needs medical attention. And of course, a person could be allergic to any of these medications. Because laxatives move things so quickly through the GI tract, the person might expel sodium and potassium in their stool. And so that can affect the amount of sodium and potassium that's available in the bloodstream. So if low sodium and low potassium show up, it can, be devastating for the mental status and the cardiac status of the patient, especially in the elderly. And we know that the elderly tend to be fairly frequent laxative users just because their peristalsis has slowed down and they might not drink as many fluids as they would ordinarily drink. We tend to get less thirsty as we get older. So the elderly particularly are at a risk for electrolyte disturbances with laxatives, but don't rule out the average younger person using laxatives too. It's part of eating disorders and other difficulties. And so it's a good idea to screen for that. Natural ways of combating constipation, we've got just encourage a lot more fluid. And that's difficult for people who aren't used to drinking water because they really, in a lot of cases they don't like it, but it does a tremendous job in taking care of constipation. If you're going to have them drink juice, you want high fiber juices like orange juice with the pulp, or kind of a natural apple juice. Now, we know if you're a mother, or well, any kind of parent, sorry dads, if you are a parent, you know that juices actually do have a laxative effect on children. However, when it comes to adults, juices, although, they could be included in that 6 to 8 glasses of fluid a day, juices are not as effective as fruits and vegetables. Like actually eating the fruits and vegetables, bran cereals, which do a great job, and then things like prunes, figs, and raisins. Any person who eats those is going to find that their peristalsis increases and their stools pass a little bit more easily. So don't forget the advantages of dried fruits and just plain fruits and vegetables, as well as high fiber cereals. Here we have a picture. This is, I thought this was kind of funny, the Girlfriend's Guide to Constipation Relief. So we see pictures of some natural products to increase peristalsis. We see fruits and vegetables, which really work the best. We see some probiotics that might help. Bran cereals, Colace, like we said, not really a laxative, more of a stool softener. And then flax seed, a bag of flax seed, which is kind of nasty, but it does the trick. So there are things that we can encourage our older clients to do for constipation besides just taking a bunch of medications. When it comes to drug interactions, whenever we're dealing with laxatives, we're dealing with moving substances through the GI tract more quickly. And so while we are moving waste through the GI tract quickly, we also are moving any medications that the patient has taken quickly. And so it can reduce the effectiveness of a lot of our drugs. And the things we need to worry about are antibiotics, which need to stay in the system, anticoagulants, digitalis, other cardiac meds. All of these can have reduced effectiveness, and also salicylates. when you combine them with laxatives, it just kind of rushes everything through and you don't have a chance to get the full benefit of your medication. When it comes to nursing actions, you want to assess for laxative abuse. You want to assess for congestive heart failure because that can affect the amount of fluid that's available in the body for laxative abuse. And you don't want heart patients straining to go to the bathroom because that stimulates the vagus nerve and that drops their heart rate. So you want them to have an easy time going to the bathroom. And I remember when I was preparing for my NCLEX, a lot of GI related questions, or a lot of cardiac related questions, had a GI aspect because they would list laxatives or stool softeners on your list of meds for cardiac patients. And, we were taught, rather than thinking, what does that have to do with anything? Remember that straining at stool, it can be a big cause of bradycardic episodes and can actually be dangerous for cardiac patients. So don't forget that. You want to assess for laxative abuse. You do not want to give a laxative if you suspect appendicitis. And the reason for that is very simple. Where is our appendix located? It's kind of at the bottom part of the small intestine where the large intestine starts. And of course, in peristalsis, that appendix moves as the intestines are moving. And that's okay normally, but if you've got an infected appendix, one that is full of infection and white blood cells, and it's swelling and it's getting more fragile, you don't want anything that's going to increase that peristalsis. You don't want that to break and spread throughout the abdominal cavity. So, a lot of times if you've got somebody with belly pain, the old time grandmas and moms would say, well, you just need a good movement. But that could be dangerous if it makes your appendix rupture. For diagnosis, you want to think of the factors causing constipation. Is this patient on narcotic pain meds? Because when you've got a person using narcotic pain meds, you've got someone who's going to be constipated. It just goes along with that. And so maybe they can't stop their narcotics. It's not feasible, but they can drink 6 to 8 glasses of water or other non-constipating fluids. They can drink or eat whole fruits and vegetables and high fiber cereals. Some of the bulk forming laxatives like Metamucil not only contain sodium, but they contain dextrose and sucrose that also help absorb water. So diabetics should watch out for pretty much anything in their laxative that has OSE, like glucose. If it ends in OSE, it usually refers to it as some sort of a sugar. And with the bulk forming, you need sufficient water. No use preparing stool to absorb fluid if you don't give enough fluid. Patient teaching for laxatives is found on page 258, so make sure that you look that over.